Hi there, I'm Vinod Mohanusundaram. My metric number is 201173164 and I'm from Polymer Engineering.
Assalamualaikum and hi, my name is Siti Norbaroha binti Ismail. My matrix number is 201173151.
Assalamualaikum, my name is Nurul Ain Sofia binti Muhammad. Matric number 201171740 and I am from Polymer Engineering.
Assalamualaikum. My name is Nurul Hidayah binti Abdul Rahman. My matric number is 201172457 and I am from UR6524002 Polymer Engineering.
Hi, my name is Siti Farhan Wilson with matric number 201172900.
Hello everyone, my name is Shani Ana Perempuan Pirmal. My matrix number is 201172898. I am a third year Polymer Engineering student.
Good day everyone, my name is Paritra Sri Balu, matrix number 201172897 from third year Polymer Engineering.
Assalamualaikum and selamat sejahtera. My name is Wan Hanisa binti Muhammad Zubir with matrix number of 201172903, Polymer Engineering student.
Hi, Assalamualaikum. My name is Nufar Shadi Zabidi and my matric number is 201172893 and I am from Polymer Engineering program with code UR6524003.
Hi, my name is Nur Shamira. My matric number is 201172458.
Good morning to everyone. So, as you all know, our group's title is The Evolution of the Technology in Improving the Organ Donations Treatment. So, I'm here to give you a short briefing about the organ donations. So, do you know what is organ donation? Yes, organ donation is the process of donating the organ or tissue of purpose transplantations which is in needs of other bodies for the failure or damage in organs or tissues. The number of the patients who need the organs or tissue is increasing by year to year. In 1999, the organ donor card was launched as an indication of person to register as an organ donor. Until now, the estimated value is 126,000 which is registered for the organ donor, but it is quite low compared with the population around the world. So here I am going to show about the types of the organ donations. For the organ part, we have a heart, lung, kidney and liver. For the tissues, we have a cornea, heart valves, skin and bones.
There are two types of transplants, which are organ and tissues. The first one for organs transplant is heart. A heart transplant is an operation in which a failing heart is replaced with a healthier donor heart. Second one is lung. A lung transplant is an operation to remove and replace a diseased lung with a healthy human lung from a donor. A donor is usually a person who's died, but in rare cases, a section of lung can be taken from a living donor. Next, kidney. A kidney transplant is a surgery to place a healthy kidney from a living or diseased donor into a person whose kidneys that no longer function properly. The last one is liver. Liver transplant is usually reserved as a treatment option for people who have significant complications due to end-stage chronic liver disease. Liver transplants may be a treatment option in rare cases of sudden failure of a previously healthy liver. Then, for tissue transplant, we have heart valve. Heart valve surgery is a procedure to treat heart valve disease. Heart valve disease involves at least one of the 4 heart valves that is not working properly. Next, cornea. A cornea transplant is an operation to replace part of the cornea with corneal tissue from a donor. Next, bone. Bone transplant or grafting is a surgical procedure that uses transplanted bone to repair and rebuild diseased or damaged bones. Surgeon might take bones from your hips, legs or ribs to perform the graft. Lastly, skin. The skin transplant is a patch of skin that is removed by surgery from one area of the body and transplanted or attached to another area.
There are 6 technology advancement in transplants. Okay, first, improve organ preservation. Organ preservation less than 4 degrees Celsius and the use of the specialized preservative solution for different organs have helped to reduce tissue damage and optimal organ preservation in vivo still until transplant. Moreover, several advanced surgical procedures are used during organ extraction to cause minimum damage to organs in brain-dead donors. Okay, next, pre-transplant treatment. Transplant patients are required to take lifelong immunosuppressants to avoid organ rejections. These drugs are not only costly but increase the risk of infection in patients. Evolving technology and science may pave the way for preparing a transplant reception before the transplant that will eliminate the need of immunotherapy. Okay, next we have organ preconditioning. Another evolving area includes donated organs preconditioning. This is aimed at expanding the donor pool by obtaining quality organs from marginal donors. Research is also ongoing in the field of tissue repairing, high precision tumor targeting, immunomodulation, and genetic engineering to expand the therapeutic options in post-patient care after transplantation surgery.
For a future direction is by development of intro organs. Globally, there is a huge shortage of donated organs and many patients are dying while waiting for transplants. Scientists are now looking at the option of developing organoids and tissues from stem cells to bridge this gap in demand and supply. However, several technical challenges need to be solved before this organ can be used for transplant. For example, integration of vascular structure and the need to generate a large structure such as the uterus. Next, this is organ preservation. At present, transplantation are required to be carried out within a few hours for it to be successful. Many organs are wasted as transplant recipient cannot be located nearby or due to logistic issue. New research is aimed at preserving donated organs for later use so that many more lives could be saved. Last but not least is by improving organ transportation. Time is the essence in any organ transplantation and logistics play a crucial role before the donor organ can reach the recipient. For example, a heart or a lung need to be transplanted within 6 hours to avoid tissue damage. Scientists have developed an advanced system in which transportation time can be increased by making the donor organs into thinking that they are still inside the body. This system keeps oxygenated blood flowing through the organs to delay tissue death.
It is true that organ donation has saved many lives. However, it does have some disadvantages, although most of them result from popular misconceptions. First of all, it has decreased donors' availability. It is estimated that the number of people in the waiting list for organ demand is increasing as compared to organ givers per day. In September 2022, 13,917 people were not able to receive organs due to the lack of organ donors in Malaysia. The problem has markedly affected the transplantation rate of organs. Furthermore, the major part of organ donations come from deceased people instead of living donors that are unwilling to donate their organs. Second, it is necessary for the organs of the donor and recipient to match with each other, otherwise the transplantation process cannot take place. Sometimes, the body of the recipient rejects the donor's organ because of the recipient's immune system rejecting the donor organ or tissue, taking it as a foreign entity. Therefore, the organ transplantation is not always successful due to the hindrance of transplant rejection. Third, the process of organ transplantation could be a painful and hurting experience for both the donor and the receiver. The degree of pain and discomfort following the procedure varies depending upon the type of organ transplanted and incision recovery. Next, chances of post-surgical infections are frequent in recipient and donor due to the lack of specific screening techniques and limited possibilities. An infection may pass on to the recipient from an infected organ of the donor. Lastly, due to the technicalities and precisions, the procedure of organ transplant is not easy on finance. During and post-operative requirement of care and support involves an increased number of expenditures. Even before the surgery is performed, the phase of matching donor and recipient organs is highly prized due to the precision of methods involved to check the donor's organ of any malfunction and infection.
Today, myself and Pavitra will be explaining about the pros of organ donations or transplants. The first benefits of organ donation is considered as a lifesaver. It is meaningful as it gives lives for the recipients. Next of the benefit is the immediate impact. It is to be said that the impact of the transplant or organ donation is as fast as the donors are healthier as soon as they emerge from the surgery. The next benefit will be better quality life. This is applicable for both the donors and recipients. As for the donors, they can have a better quality life because they have helped many of them to overcome from a disease. As for the recipients, they can have a better quality life because they are able to regain their normal lifestyle. That's all from me, and now I will pass it to Pavitra.
Now I would like to explain my point on pros of organ donation. My first point on this is multiple recipients. This has been mentioned because according to the statistical record of American government information on organ donation and transplantation, an average of 8 lives could be saved by a single individual who is willing to donate his or her organ. For example, 2 donated kidneys can free 2 patients from dialysis treatment, and also 2 donated lungs mean another 2 patients are given a second chance. The statistical analysis is based upon the number of organs donated by the person. For example, 2 kidneys, 2 lungs, heart, intestine, pancreas, and also liver. Other than that, the cornea of eyes, skin, and various body tissues are also being donated. My next point is personal contentment. Patients in the waiting list of getting organ are in extreme pain of suffering. Their families are also driven by the endurance of complaint as their loved one is under intense physical and mental suffering. Under the light of the constant pain, the organ donor acts as a ray of hope not only for the patients but also the afflicted family members. Besides that, no age limitation is one of the biggest advantage for an organ donor. An individual is not held back by age limitation in order to donate their organ. People of any age can act as an organ donor unless they are not affected by any serious illness or disease such as HIV and AIDS. Even children under the age of 18 years are eligible to donate their organs under the written consent of parents or their guardians. That's all my point on this part. I will pass it to my another group member. Thank you.
Today I will be presenting about the possible future technology for replacing organ function to improve the efficiency of the current technology of organ transplantation that relies heavily on organ donation, whether from a living or newly deceased donor. These possibilities in new technology in replacing organ function is still in progress or in trials, as there are still many flaws that need to be considered before implementing it worldwide. But with the rapid development of technology, it will not be long before they can become a reality. First on the list of possible future technology of replacing organ function is xenotransplantation. In principle, it could provide a plentiful, inexpensive, and physiologically satisfactory replacement for the major parenchymal organs, as organs from large animals like pigs can be used in humans using genome editing techniques. However, to date, no genetic manipulation has allowed organs from pigs to survive and function long enough for primates to propose those organs in people. And no approach yet tested has allowed survival and function beyond a brief period without severe manipulation and/or immunosuppression. Next on the list is fully implantable devices. They are available experimentally to replace the function of the heart and only used in extreme condition, and their use engender substantial risk. However, with continuous research, the technology can improve its use, and one can envision that all cardiac replacement may one day be addressed this way. So, as a conclusion, we can conclude that only with more research and experiments that we can better our current technologies of replacing organ function to a better technology in the future. That's it from me. Thank you.
Next, I'd like to talk about the technology we have right now for replacing organ function. Basically, there are two main types of technology that are commonly used in organ transplant, which are frozen organ transport and living organ transport. So, for frozen transport, it is a technology that is very important for replacing organ function because organs will die in just a few hours if they are not quickly frozen after they are removed from the donor's body. So, it is very important that frozen transport technology must be used even until now since it does its job very well. Next, for the next technology is transport of living organs. Living organs transport is often used with OCS, which stands for Organ Care System. This system is meant to keep donor hearts healthy before they are being transplanted to the other bodies. So, this system has a portable box to keep the donor's heart warm and give it oxygen and food, as well as a solution to keep the heart alive.
So in conclusion, organ donation is one of the most effective way for those with an end-stage organ failure. As we can see, modern technology in organ donation has given us all kinds of resources and facilities to help saving or extensions of someone's lives. In future, scientists have been studying the potential to increase organ supply and reduce waitlist mortality for critically patients by xenotransplantation and implantable medical devices. It is clear that the technology in organ donation have been improving. However, by using this kind of organ donation technologies, the risk of having chronic rejection, zoonotic viral transmission to human, and cybersecurity risk might be increased. Therefore, it is hoped that there will be more improvement and research in organ donation technologies to increase the longevity and improving the quality of life to people who are suffer from chronic disease across the world. Thank you.